and now to uncertainty for thousands of Oklahomans caught in the middle of a contract dispute between Integris Health and United Healthcare.
It's a battle over benefits, and many of you have likely received this email from Integris today. Both sides are telling us they're working toward an agreement, but if one isn't reached by February 7th, United Healthcare patients will be considered out of network at Integris. And of course, you know that costs more money. News 4's Sydney Batzlaw picks it up from here. Sydney.
Kevin, Heather, this isn't something unusual to see. In fact, these type of negotiations are becoming more public and way more frequent. In 2022, there were at least 50 high-profile contract disputes nationwide. That number rose to more than 130 in 2024, and all of them bring a lot of uncertainty for patients.
I was kind of taken back by it because, you pay for your health insurance and you don't expect to be told that, hey, we're not gonna honor this anymore.
Those were the fears facing a patient in 2022 when United Healthcare was in negotiations with OU Health. Now the same thing is happening, but this time with Integris Health. Patients receiving this email saying if an agreement isn't made by February 7th, hospitals, employed physicians, and several joint venture partners would be considered out of network. A United Healthcare spokesperson told us in a statement, Integris Health is demanding a more than 20% price hike that would make it the most expensive health system in our commercial network in Oklahoma City. United Healthcare says that adds up to more than $64 million.
There's pressure on the insurers to make sure that they make profits for the people that own their particular healthcare group. While at the same time, physicians have seen significant increase in costs to run a practice as far as inflationary costs for supplies, salaries, even increased utility costs.
Both sides say they're working toward an agreement, and for now, nothing is changing, but the waiting game is still stressful for patients.
These are patients that may be receiving chemotherapy, or maybe they're about to go in for a diagnostic procedure, or they're about to have surgery for a cancer. And all of a sudden, they don't know if they're going to be able to keep receiving that health care at that facility or not.
The Oklahoma Insurance Department doesn't regulate these contracts, but is watching closely.
The disruption that is involved if this falls apart is no small thing. And so we monitor. We will have conversations, but we don't have an official role.
If negotiations fail, patients on employer-sponsored commercial plans and Medicare Advantage plans would be affected.
CMS will most likely declare a special open enrollment and allow folks to make some changes.
For now,
take a deep breath and realize that this does happen often, and we're over a month away, just over a month, but still quite a bit of time to negotiate that.
The state insurance department says you can call them if you need help. We reached out to Integris for a comment beyond the email they sent to patients, but haven't heard back. It is the holidays, though. We'll keep you updated on what happens next.
And we'll look for those updates. Thank you. Affects a lot of people.